Hi there. Umbilical cord compression. It can happen, and it happens in various ways, and it is extremely dangerous. Umbilical cord compression is when the umbilical cord gets squeezed in some form or fashion, and the blood supply that is going to the newborn gets kinked in some way. Without blood, then the baby is not getting oxygen, and without oxygen, the baby's brain is going to get damaged. Umbilical cord compression can happen in various ways. Sometimes the baby ties a knot, just doing loops inside the womb. Sometimes between the baby's body and the mom's pubic bone, there can be some compression where the cord gets stuck in between. Sometimes the umbilical cord comes out of the mom's birth canal. That's called prolapse, and that can also occur. Sometimes the baby's umbilical cord wraps around the baby's neck. And all of these things compress the umbilical cord and cause blood supply constriction. When this occurs and brain tissue damage occurs, that becomes a problem called hypoxic ischemic encephalopathy. When you have these issues, brain damage occurs and a whole host of symptoms and injuries follow that as well. It's extremely important that if there are signs of oxygen deprivation that occur, then it's usually because of an umbilical cord compression. That intervention happens very quickly. Intervention can be repositioning mom, giving her more oxygen, or even worse, a surgical intervention that happens very quickly. If you have more questions about HIE, umbilical cord compression, you need to speak to a birth injury lawyer. My name is Adam Funk, and I am a birth injury lawyer, and I would be happy to speak to you.